We are recording. Welcome to today's session, Connecting Communities to Health Information, Graphic Medicine Kits at the Public Library. Before I turn it over to Brittany Netherton, I would like to introduce myself. My name is Sarah Levin-Lederer. I am an Outreach and Education Coordinator with the National Network of Libraries of Medicine New England region. And I also would like to do a very quick introduction to both the National Library of Medicine and the National Network of Libraries of Medicine. I know quite a few of you have probably joined us in the past for webinars, but just so everybody's on the same page about why we're doing this webinar, who we are, things like that. So first of all, the National Library of Medicine is an institute of the NIH. It is the world's largest biomedical library and is actually a physical library on the NIH campus, but is also responsible for creating and maintaining about 300 databases of health and biomedical information, ranging from the general public, such as MedPlus and PubMed, or all the way to highly specialized databases. And NLM is the outreach arm of the National Library of Medicine. The network is an 8-region system. So I am with the New England region. We are Region 8, which serves Connecticut, Rhode Island, Massachusetts, Vermont, New Hampshire, and Maine. And then the system itself is designed to be responsive to regional needs. So trainings like today's, as well as in-person training, exhibiting at events, connecting partners, and also through funding. And so I would encourage all of you to reach out to your region. If you are here in New England, I'm happy to field any questions you might have about graphic medicine, emergency preparedness, or public health. I have colleagues who specialize in other areas as well. And there are similar folks in your region as well. England also has a graphic medicine special initiative that I wanted to mention. We focus on graphic medicine, and we do that by having book club kits, which are programs in a box. People can try out graphic medicine if they want to share it with their colleagues, give them a taste of graphic medicine. These are kits that are free to anybody in New England and do circulate outside of New England for folks who with some special caveats to that. I'm also always happy to share what we include if you're interested in sort of trying to replicate it elsewhere. We recently supported the New England Graphic Medicine Conference, which had to unfortunately be moved from an in-person to a virtual conference at the end of March. And then I'm also in the process of redesigning the Graphic Medicine Initiative website to continue the educational and informational outreach around the topic. So with that broad introduction to the National Library of Medicine, the National Network of Libraries of Medicine, and why we are interested in graphic medicine, I'm going to turn it over to Brittany Netherton, who is the Head of Knowledge and Learning Services at Darien Library. Graphic medicine combines two of her favorite job duties, writing about graphic novels and curating graphic novels and disseminating reliable health information. She has presented on graphic medicine and other graphic novel topics at Comic-Con International and New York Comic-Con. So with that, I am going to turn the presenting duties over to Brittany, and I'm also going to mute myself and my camera, but I will be in the chat if anybody needs anything.
Okay, thank you so much, Sarah. Let me get these controls down. Hello, everyone. I'm so happy that you are joining us today, and I hope that wherever you are, you're as well as you can be. Today we'll just be talking about the graphic medicine kits at my library. I'm the head of knowledge and learning services at Darien Library, and I introduced graphic medicine to my library in 2017, and then I spearheaded the creation of graphic medicine book club kits as a way for us to combat health misinformation, to foster difficult conversations in the community, and build community partnerships. So today, talk a little bit about that process of creating and promoting those kits. So just a brief overview of the presentation today. We'll start out with a quick look at what graphic medicine actually is. We'll talk about how you can determine the community health needs in your community. I'll tell you about how I created my kit, the promotion and the challenges I faced, and then we'll leave some time at the end for any questions that you might have. And as Sarah said, if you have questions as we go, just put those in the chat, and she'll be able to field those so we can answer them at the end. So what is graphic medicine? I wanted to add this slide because some of you who are tuning in may not be as familiar as others. I normally, when people ask me just off the cuff to tell them what it is, I usually just say that it's the intersection of comics and medicine, or comics and healthcare. It is a fairly broad term, and many people have different ideas of what is or is not considered graphic medicine. For the purposes of today's presentation, let's just think of it simply as comics that contain a major health or wellness theme. If you want to learn more, I highly recommend the 3 sources on this slide. I understand that some people may be tuning in today with small children that they're looking after, or animals, and may not be able to be looking at the screen. So when I can, I will read. I normally try not to read my slides, but I want to do that for you. So the 3 sources are the Graphic Medicine Facebook group, #GraphicMedicine on Twitter, and graphicmedicine.org. So how can graphic medicine kits benefit your community? First and foremost, they're a great way for you to spread reliable health information to lots of different people. So within each kit, included with a book or books of your choosing, will be a packet of materials from trustworthy health and wellness organizations like the National Library of Medicine and affiliates, that's curated by a librarian. So think, for instance, about if you wanted to create a kit on depression for your community. Depression as a term is something that we hear sort of tossed about a lot. There's a lot of misinformation out there about it. So you could put together a kit about depression and make sure that you included materials that defined depression for your readers. You could use the Medline Plus article on depression. You could include information on how to recognize signs of depression, or how to help someone you love who is dealing with depression, or any number of other really helpful things to get that correct information into the community. The other thing these kits can allow you to do is start conversations on topics that can be difficult or scary for some people. And in initiating those conversations, you are helping to break the stigma around those topics. And then it also can help readers build empathy by being exposed to new ideas or experiences. So for instance, one example that I used in a group that was considering, a book club that was considering reading our mental health kit, which features 2 graphic memoirs on bipolar. In order to pitch it to them, I went to the nonfiction section in our library and I pulled off a book about bipolar, just a regular textbook. And then I went and grabbed Marbles by Ellen Forney, and I took both of them and said, I want you to imagine that someone you love has just been diagnosed with bipolar disorder, and you want to learn more about what bipolar disorder is so that you can be there for your loved one. You can read this book, this regular nonfiction book. It has a chapter called What is Bipolar Disorder, and it's 32 pages long, all text. Or you can read the specific 2 pages in Marbles by Ellen Forney, in which she illustrates and describes what bipolar is and defines it in 2 pages. If you are wanting to dive into this topic that is completely new to you and you are sort of feeling iffy about it, which one of those would you rather go to? And they all, of course, said the 2-pager. And it helped them to understand that these kits can make these difficult topics more approachable. And that also, you're not only exposing them to those new ideas, but also sometimes a new way of reading. Many of these adults, because my kits are specifically for adults, they don't read comics. They think that comics are something that is just for children. And so we're also exposing them to a new format of reading as well. So how to start with a project like this? These 7 points are just based on my experience. They're what I would encourage you to try. The first thing being really sit down and figure out what you want your kits to be themed around, and we'll talk about that a little bit later. I want to make a few points here. You'll notice that number 2 is figure out the logistics. I did not do that until further down, and it was a significant stressor for me. So I recommend meeting with all the people who might be impacted by the creation of these kits early on in the planning. So that's your catalogers, materials management handlers, book club coordinators, programming librarians. And if you're doing this with a grant like I was, meet with your bookkeeper to figure out how they want you to code items as you purchase them for this grant. And it's going to save you a lot of work in the long run. You'll also notice that promote is on here twice. I suggest you get the word out about the kits while you're waiting for all of your items to arrive. That way you can go ahead and line up potential readers who want to take them as soon as they're ready to go out the door. And then promote them again once they're assembled and ready to circulate, because that's when you can get nice pictures and post them to social media and do all of that stuff. On the left here, I did just want to mention, this is one of my favorite things to come out of ours. Our publicity manager did, I think, a fantastic job creating this graphic medicine logo for us to use to brand all of our materials. And I just get happy every time I look at it. So when you're determining the themes that you want your kits to focus on, there are some pretty good ways to do that. First, I would suggest find out if your local hospital has a community health needs assessment. We looked at the one for our local hospital and figured out that the 2 major concerns in our town were mental health and substance abuse. So we were able to take that into consideration when we were determining which kits we wanted to build. Also think about patron interactions. If you're working a service desk, what books or what topics are people asking you for information on? If you're not working a desk, but you're in a job where you can see the materials coming and going, think about what books are circulating, and not just nonfiction. Think about the fiction books that are going and coming, and if they have any sort of health or wellness themes to them, because that might clue you in on interest in the community. And then think about cross-promotion. Does your library have any existing initiatives that you could either partner with or work with to promote these? So if you have a meditation group that meets in the library routinely and it's very well attended, it's a great program, is there maybe a kit that you could put together and offer to those people or anything like that? And then also consider your budget, the space that you have for storing these kits and for displaying them to the public, and then the time that you have available to dedicate to this and the personnel that you have that can help you. So as you're choosing books to add to your kit, you figure out your themes, you want to see what books are available. These are two resources that I highly recommend. On the left is a link to a graphic medicine database that is maintained by Alice Jaggers, who I think is here. Hi, Alice. So this contains hundreds of graphic medicine titles and what topics they deal with. So it's really, really useful if you identify a topic, you can go there and see the books that would fall into that topic. And then on the right-hand side is the comic reviews page for the graphic medicine website, where you can find reviews of graphic medicine titles. And you can use them in tandem. You can easily go find a book on Alice's database and then go over to the graphic medicine site and search for it by a title to see if anybody has given a review. And that way, you can make sure that you're getting the books that are best for your community and your budget. I intentionally chose mostly graphic memoirs for my kits because that's what circulates well in my community, but you should do what works best for your community. So, this is a picture of the kits that we created, -1 because it wouldn't fit on the shelf. We ended up creating 11 kits for our library, and these kits can be checked out by individuals or by book groups with up to 10 members. And I'll read those kits for you in case you can't see the screen. It's aging parents, Alzheimer's, anxiety and depression, childhood trauma, emergency preparedness, grief, LGBTQ, maternal health, mental health, practitioner perspectives, and veterans health. We based our kits on the existing kits at NNLM NER, and those kits include 1 book per kit. We did decide to include 2 books in our kits, and we did that for a couple of reasons. The first is that we have a really robust book club program at our library. For adults, we have about 115 active book groups. And for the most part, these are people who sorry, I got distracted by the chat. These are people who read the books very, very thoroughly and come ready to fully discuss. And I already knew that pitching a graphic novel would be difficult in some cases for some of those groups. So I wanted to make sure I gave them enough content to where they still felt like they were getting that same length that they were used to. And then the other reason for 2 books is because I wanted to make sure that there were multiple viewpoints represented in the kits. So for the mental health kit, for instance, I didn't want to just give one narrative of bipolar disorder. I wanted to make sure that it was clear in the kit that that bipolar can affect people in different ways. And so that kit includes Marbles by Ellen Forney and RX by Rachel Lindsay. In addition to the books, we include a how-to sheet, just a short 2-page handout on how to read a graphic novel. The one that we use is by Jessica Abel. I think there are several online, and that's just to ease people into it if they're not used to the comic format. We also include discussion questions. Some of the questions that we include are based on the existing questions from the NER kits, and some of them were written by us. We split the kits up between the 4 of us reference librarians, and between the 4 of us, we read every book and then wrote some of the questions. And the way we split it for each discussion is 3 questions about each individual book, and then 3 to 4 questions about both books together. And then at the bottom of our discussion questions, we do have a link to a survey where people can give us feedback on how they use the materials, what they thought of the kit, and any suggestions for improvement. And the last thing in the kit is a packet of health materials that we've curated from NLM and other organizations, just to get that health and wellness information out into the community about that chosen topic. And those materials are the readers to keep. They do not have to come back with the kits. The only thing that has to come back is the bag and the 2 books. So some things to consider. The things that you don't think about can end up being the most significant challenges that you face. And I'm putting a bunch of questions on this slide because they're all questions that were asked of me for the most part after I had already ordered everything and was kind of ready to go. And just things that didn't cross my mind because they're not things that I deal with on a day-to-day basis, which is another reason it's very important to pull in all of those people who will be working on this. So I'll go through a couple of these, thinking about what you'll put them in. When I originally wrote this grant, I envisioned large cloth bags for the kids that would hold all the books. And because regular book groups at our library, most of them send one representative to pick up all the books at once, and then they distribute them to the members. And so in my brain, I thought, well, of course, this will just work the same way. But once the books start coming in, you notice that 20 books and 20 discussion packets in one bag is just not feasible, and it was not a great idea. And then the other thing was we had to think about how to actually catalog these. And so when I talked to the cataloger and the head of materials management, they said, well, if these have to go out as a pair, if these two books have to be together, then we don't need to catalog each book individually for circulation. The bag itself needs to be the thing with the barcode. And so I had budgeted in my grant proposal for 11 large cloth bags. And now I learned that I need to purchase instead 110 smaller bags, which is significantly different, and ended up working out. But something, that wasn't on my radar until other people mentioned it. Thinking about where they'll be shelved. I was so excited at the idea of just getting them into the building that I didn't really put much thought into where they would actually be stored or how we would get them into the public eye. And so for a long time after they were created, they just lived in my office and in our storage area in the basement. And I think I was very hopeful that just the act of promoting them by word of mouth and on social media would do the job. But I think that it would have been great had they been able to go straight out onto a shelf where people could actually see them when they were ready. And then think about the items that you're purchasing and whether there are enough of them available for the number that you need. I purchased one book, American Widow, that is all but impossible to find online, and I didn't know that until I had already ordered copies from several different places. And I had a few copies come in, but then I had my largest order canceled due to inability to fill the order because it is a hard book to find. So that caused a delay in that particular kit being available to the public, and it also ended up being a bit of a bookkeeping issue because of the refund. If you make several of these kits, you'll have a lot of materials coming in at different times, and it can be difficult to keep track of them. So I recommend making an Excel file with your projected costs, updates to reflect the actual costs, and then any other pertinent information. So you'll see here I have personal equipment, supplies, the units, the cost per unit, the total cost, and then the supplier that I'm getting them from. You can't see it, but I do have extra columns to the right where I track a narrative description of each item, invoice numbers for those orders, and then which item they're coded to in my own budget. And this sheet helped me keep track of the money I was spending, the items that arrived damaged and needed to be returned or refunded, because if you were ordering 40 books at a time and Amazon sends them all in one box, some of them will be damaged. And then which line items in our budget the purchases were coded to. I wanted to include this slide because one of the things that took the most time for me was that bag issue whenever I learned that we were going to have to buy 110 bags instead of 11. And I'm putting what I ended up doing here. in the hopes that if you decide to leave this meeting and do this on your own, it will save you the trouble. So the bags I ended up purchasing were hanging media bags from Demco with 2 different sizes. The red ones are 14 by 11, and then our blue ones are 11 3/4 by 9 1/4. And get the gusset style because it's just easier to fit more material in those bags. One of the big concerns for us was that our book return is automated, and it consists of a series of conveyor belts and sharp drops. So we needed to make sure that we had a bag that wouldn't spew books everywhere as it was being returned. And so we did opt for these bags specifically because they had a zipper closure. I also, from Demco, ordered graphic medicine spine labels. Since we were barcoding the bags instead of the books, we needed some way to identify those books as library books so they wouldn't just get added into people's home collections. So we used these spine labels you can see in the picture on the left, as well as mailing labels for the library. And I have a picture on the next slide. I can show you what that actually looks like. I also used file folders and cardstock to protect the printed materials. If you just put the loose paper in the bag with the books, it doesn't take them very long to not look great. So cardstock and file folders just keep it looking neat and tidy, and makes it easier for the people to then use those materials when they need to. And then we ordered label protectors, some large ones to hold the barcodes on the bags, and then small ones to hold those spine labels on the books themselves. I will tell you that the large ones for the barcodes on the bags ended up not working as well as we needed, and we just opted to buy book tape to use instead because it's a bit more flexible, because as those bags get sort of like smushed around, those label protectors tend to just pop off. Here's what those look like. So in the picture on the left, you can kind of see on those books the Darien Library mailing label that we affixed. And then on the spine is the graphic medicine label. And then on the right is the label that I made for each kit. So it includes a list of things in the bag, the barcode needed to check it out, and then a little note asking them to please return it to the welcome desk. They can still send it down the automated book drop, but if they bring it to the welcome desk, we can go ahead and check to make sure both books are in. So just cuts out a little bit of time. So this is what one of the kits looks like in our online catalog. The summary is the same for every kit. I just wrote one summary. The place where it differs for each kit is the last sentence, where it just says what books are included in that particular kit. And then this is what it looks like in the ILS. So there's the summary again. The bottom 2 arrows were really important for me. I wanted to make sure that these books could be found if people looked for the phrase graphic medicine, as well as graphic novel. If they looked for the topic, so in this case, aging parents, and then also illustrators and authors of the books. So moving on to promotion, we did one big promotion push after we had the kits ready to go. We invited Rachel Lindsay to do a keynote for our entire community. She did a great job of talking about the process of creating a comic, reliving trauma via graphic memoir, and her life post-publication. As a reminder, she wrote RX, which is one of the books in our mental health kit. In addition to inviting Rachel to give that keynote, we got one of our book groups to be guinea pigs to actually test run the mental health kit in their group. And I was really excited about them doing it because they're all very well read, very adventurous readers, so willing to try new things, and they're open and honest with their feedback, so I knew that they were just going to tell me like it was, which is exactly what we needed whenever we were launching this program. And the best thing about them doing it is that they were scheduled to meet together to discuss this kit on the same day that Rachel was at the library. So they got to come see her talk at 3 p.m. and then have their discussion at 7 p.m. and take into account what they had listened to her present earlier, which was really cool. And the other thing I did with that group was I actually invited a medical librarian to sit in with them while they discussed. That way, if they had any medical questions, they would be able to ask her and she could field those. And in addition to that big push, those two specific events, we promoted the kits in the book group newsletters and in various community organizations. We reached out one-on-one to practitioners in town and specific book groups, and several expressed interest, but none of them followed up, which leads us to the challenges. So no librarian in this meeting right now is surprised to hear that just getting them out the door is the hardest part. It can be challenging because you don't know what form of contact is going to work for one person versus another, or one group versus another. But the key is just to keep doing it and get creative and try different avenues. The picture on the left, I have to laugh when I look at it because I told you earlier, whenever the kits were made, I didn't have a place to put them. And for a long time. And finally, one of my other department heads, they were no longer using this audiobook shelf this fall, and asked if I might want it for the kits. And of course I did. And I was so excited to get it cleaned up, get it pushed out. It's right next to the graphic novel shelf. Put the signs on it, got them put out, and then I think it was 3 days later we closed for coronavirus. So I was so excited to finally have them in the public eye, and then we were no longer open to the public eye. But that's okay. Within, I think, 3 hours of just putting those out where people could see them, the anxiety and depression kit circulated. And so I am hopeful that once we get back to work and the building is open, that being able to see these will entice more people to check them out. Some additional challenges that you might face are the lack of follow-up, not only from people who say they're interested in a kit but then don't really respond back to you, but on the surveys themselves. So despite the survey being at the bottom of the discussion questions, which is very intentional because theoretically that's the page in that packet that everyone is sure to read, hopefully, it's difficult to get people to submit those. With the book group that we guinea pigged, after only one person had submitted their survey, I actually printed physical copies of it and took to their meeting and asked them to just fill them out and leave them in the room when they left, and I would come back and collect them. And that didn't work either. Some of them said, well, you know, I have so many thoughts, and I really want to take this home and fill it out thoughtfully, and then I'll bring it back, but did not make it back to me. So that is a substantial challenge, is just getting that feedback. It's also challenging that many of these topics have a stigma surrounding them. So they're difficult to recommend to people because, you know, people might sort of withdraw or be hesitant to read them. But not only the topic, but the format. Again, some people, whenever they find out that it's a graphic novel, just sort of like immediately disqualify it. And so that is something that you'll be working through probably. And then they're also time intensive. So you want to read all the books that are in the kit so that you can recommend them to people. I try to be really careful about my recommendations. For instance, we have a grief kit, and I would never recommend that kit to someone who is actively going through the grieving process because those books are just really heavy. But if someone who loved someone who was going through a grieving process wanted to read that kit so that they would have a better understanding of what their loved one was going through, I would absolutely recommend the kit in that way. So it is important to read those thoroughly and to be able to think about those things when you're doing your reader's advisory. The other thing that takes a lot of time is writing the discussion questions, because you want them to be meaningful and to really to stir up sort of those difficult conversations. Ordering the materials takes a long time if you're ordering a lot. Assembling the kits can take a while. The act of promoting it is a job in itself. And then maintaining the bags as well. So thinking about when those come back to the library, where do they go? Who is the point person? And then making sure that every staff member knows that, so that the bags don't just get sort of like lost or misplaced. Making sure that before they go back in storage, for instance, they end up with someone who can refresh the paper materials inside, so that the next time it's needed, it's just ready to go right then. And so there are quite a few challenges with doing a project like this, but I want to remind you that the benefits are worth it. You've seen this slide before, but it bears repeating that these kits are a fantastic way for you to spread really important information about these health and wellness topics into your community, and start those conversations to break down that stigma and to help your community build empathy for others who may be experiencing different things than they are. That is the last slide that I have. I hope this was helpful. I haven't been looking at the chat because I couldn't pay attention to both at the same time. So I'm excited if there are any questions. If you would prefer to contact me on your own, I've put a Twitter handle and my email address. I'm happy to talk to you about any point of this process. I am an open book with this, because I would love to see you implement these at your library, and whatever I can do to help, I am happy to do that. I will say that because of the work from home situation, my email inbox is a little in disarray right now. So if you email me, I will get back to you. It might just take me a little while, and I hope that you'll bear with me with that. So questions?
Yeah, questions.
Okay.
So Rachel Walden actually was wondering if there were any specific suggestions for improvement. So they've been out there a little bit. Have you been getting feedback? What's the feedback been like? Have there been suggestions for improvement?
One specific suggestion for improvement came from someone who read the grief kit. So our grief kit contains Rosalie Lightning by Tom Hart and American Widow by Alyssa Torres. And this person suggested that they would like to see a book that focused more on the spiritual aspect of the grieving process, because their experience was as a grief counselor. And they noticed that in all of the groups that they were leading, that spirituality became a really important topic, and that wasn't necessarily represented in the kit. The other pieces of feedback, I can't remember any others distinctly. Oh, that's awesome, Kelly.
Just so it's read into the record, Rosalie Lightning really helped me understand my friend's grief after loss of a child. Your suggestion was spot on. From Kelly Ham. So actually, and I think that actually leads well into, you mentioned that there is some stigma about the format, but there was a question in the chat that the library has a pre-existing graphic novel book club that may not be interested in health topics. Are there any tips for sort of getting over that stigma, like introducing graphic novel folks to graphic medicine?
Yeah, so the beauty there is that some of these titles deal more heavily with the topics than others. And so you could always kind of transition in using a title that contains those elements, but isn't necessarily just about those elements. So the first one that comes to mind for me is Hey Kiddo. I think that would be an excellent one to start with because you don't even necessarily have to focus super hard on the childhood trauma aspect of it. You can read it just as a memoir and discuss other areas of it instead of focusing on I say childhood trauma because that's the kit that it's in for us. You could put it in any kit that you wanted for your library. But if you could find some of those that are, or like Fun Home is in our LGBTQ kit, but you could discuss that book in any number of themes and topics. And so maybe finding one that instead of something like Rosalie Lightning that is very, very much about grief, finding something that contains those health and wellness topics, but is also a story with other pieces that could be discussed would be good.
So then several questions about kid-friendly kits or teen-friendly kits, either, you know, if any ability to use what you've created in that way or suggestions for sort of broadening out to those audiences as well?
That's a really good question. So our anxiety and depression kit is Hyperbole and a Half by Ali, I think her last name is pronounced Brush. If I didn't get that right, I'm sorry. And then it's Adulthood is a Myth, I think is the one by Sarah Anderson. It's one of the Sarah Scribbles collections. I think those both are very teen friendly, even though they're both millennial authors and millennial points of view. I think that there are things in both of those that teenagers can also relate to. And so that would be a good one. My dream goal, if these adult kits work out really well, is to also create children's kits. I would love to create kits where parents and children can read the books together and discuss. And I think immediately of Raina Telgemeier's books and how good it would be to have an anxiety kit with Raina Telgemeier's guts. And for parents to be able to talk to their kids about, like, do you ever feel this way whenever you are in class or when you're with your friends or when you're in a group of strangers, and to be able to have those conversations between them. There are a number of wonderful comic books out right now that are children's titles that are graphic medicine. I think this would be very easy to do with teens and children.
So in the chat, somebody gave a shout out to Susie Bell's El Deatho, which is
yes,
personal favorites. And then also that there have been kits focused on pet death and grandparent death that would probably be very friendly.
Oh yeah, those would be really great topics. Oh, I see now there's a clarification. Do you find averse to reading teen or children's titles, or do they take it in stride? I haven't personally had experience with recommending teen or children's titles to the adults that I work with, but I will tell you that one of the adults in the book that read the mental health kit sought me out after she had finished reading and asked me if I had recommendations of a children's title that she could read with her kid. So, and specifically a graphic medicine title. So she was not averse, but she had a child. And so I don't know if that makes a difference. But if anybody here has had this experience of recommending teen and children's titles to adults, I'd love for you to add those in the comments.
I think there's also the stigma that you mentioned about the format in the presentation, where a lot of adults think that comic books and graphic novels are only for kids and for teens. And so a lot of times they may be surprised when you hand them something like Rosalie Lightning or Marvels that are very much not for kids. And, you know, you might be able, teens, I think, could see some things in them, but a lot of the time they're talking about language and imagery, and I don't mean like bad words. I mean like metaphors and similes and visual language that would just go over a kid's head but would make sense to an adult. And so, you know, even getting folks to sort of understand that graphic novels sort of run the gamut and can talk about all kinds of different things as well. I'm trying to monitor. Question on the availability of materials to help other libraries replicate what you did.
Meaning could I share the books that are in our kits and the materials that are in the packet?
I was thinking, as I understood it, and Anna Moore, if you wanted to clarify if I get this wrong, yeah, the packets, the discussion guides, any of the handouts, because the books themselves, they would have to go and add to their collection themselves.
Yeah, I'm happy if anybody is interested in any of the materials that are included in those kits, reach out to me. I'm happy to provide any of that. I know Sarah did that for me whenever I was building them. I asked, you know, what materials, just so I have an idea, what do you include in so and such kit? And she's very nice to send me a table, and I'd be happy to pay that forward.
So, and I will also say that any of the discussion guides that were created for the NER kits and any of the materials that we include in our kits as well, I'm happy to share those. The discussion guides, we are happy for libraries to use wholesale, so you wouldn't have to take anything from them. You could just include those as they are. So, you know, feel free if you're looking to recreate this stuff to either reach out to me or to Brittany to see what kits we have available, what topics, what books, things like that. There was a question about working with doctors on graphic medicine, tool for diagnostic, ongoing therapy sessions, or to gain empathy with patients. You want to talk about this? Or I can also pull this one.
I might throw that one to you, since that hasn't been my specialty.
So I will say that using graphic medicine with healthcare providers is actually one of the places where graphic medicine started. Using it with students, health professional students, as a way to build empathy. And now I'm completely blanking on some of the other things. But there is sort of in tandem to graphic medicine for the general public, this idea of graphic medicine for providers, for clinicians, for students as well. And so we do have, and unfortunately I can't unmute them, a couple of medical librarians, in the chat. So if they have any thoughts on that, feel free to throw them in there. But you know, there are some med schools that have graphic medicine collections, things like that, as a way to, as another way to talk about health and healthcare and things like that. So it is something that exists sort of as a parallel to, okay, how do we use graphic medicine with the general public? How is graphic medicine possibly used with patients and their families? How is graphic medicine used with their providers as well? Let me check my notes. So in the chat, there was a comment that a lot of adults were surprised and happy to read, "Can we talk about something more pleasant?" They found it easier to understand life situations. And I actually really like that comment because I think it's a really good illustration of what graphic medicine can be, because it stigma, where Roz Chast has said some of the worst things that you could probably say about the situation and her feelings. She can pull back in terms of the negative feelings, and so it opens it up to discuss, hey, sometimes it's not that great. You know, sometimes we don't have these altruistic feelings about our aging.
Yeah, that one is amazing. I actually included that one in our Aging Parents kit, both because it's an incredible graphic memoir, but also because of Roz's name recognition with our community, as a way to sort of like not really trick them into reading a kit, but just as a way to be able to convince them to give the kits a try. It's the same reason Fun Home is included in one of the kits, because of the name recognition. Those two kits in particular are the ones that I try to lean on whenever I get some pushback from groups, because those are two things that they have heard about, and so it's more likely sometimes that they'll be willing to give it a shot.
So I want to not a question so much as a comment in the chat, but I think it's the one that goes back to this conversation about overcoming some of the stigma of the format and this idea of graphic novels and kids literature and adults and all of those things that are playing together, that Trisha Adamus said that she is going to have a book club discussion on the truth about Stacy, and thinking that they might be able to pull some people in with nostalgia, since it's a Babysitters Club book that has been adapted to graphic novel format. And I just thought that was a really
good idea.
Yeah. We have a few more questions, or sorry, a few more minutes if there are any other questions. Otherwise, I can do my wrap-up stuff. So actually, I will do my wrap-up stuff, and if we get any more questions in the next couple of minutes, we can.
I see a question about what I budgeted per kit.
Oh, yes. Thank you for on that again.
It varied. Let me, so if I can just go back here, you can see my Excel sheet for a little bit of that info. You can at least see what the bags and the labels cost, and then the books varied wildly. So anywhere between like $5.40 to like $28 to $30. So each kit had a different price point on it. I do actually, because I had to put together the replacement cost for each kit, that is information that I can provide if anybody needs it as they're planning, just to see roughly what a kit might cost in all of those categories that we did. So just shoot me a message, and it's not something I have right now, but I can get that information. I would suggest okay, so there's another question in the chat. We're a small library and are interested in starting a graphic medicine kit, maybe a few. What do you recommend since we're very small? I think starting with a few, first of all, is a really good idea. Just having a small selection to really get that momentum built. I would say I hesitate to give any recommendations, because I think the most important thing is what works for your community. So like I said, memoirs circulate like crazy community. So I knew for a fact that whatever kits I made, they probably needed to have memoirs in them. Because if all else failed, I could stop saying graphic novel and I could say graphic memoir, and that might make all the difference to someone. And think about, again, those health needs in your community. So if mental health is a big priority, do that. If substance abuse is a big priority, do that. I'm happy to, here's just a reminder of the ones that we created. If you have questions about which books are included in any of these, I'm happy to tell you what we did and why we made those decisions. I see you have a staff of 3. We have a staff of 4. And so I totally get that concern of the time management and just the ability to read everything. So happy to work with you on that.
So thank you all for joining us today.
Yeah, there's such nice things, and it is making me happy. Thank you.
Yeah.